As a general rule, the procurement of pharmaceutical products and clinical supplies for the Health and Social Services Ministry is done in line with the Public Procurement Act. There are more than 1,400 pharmaceutical products and clinical supplies on the procurement list, and they are grouped in three bids, namely antiretroviral products, pharmaceutical products, and clinical supplies. All bids higher than $25 million are handled by the Central Procurement Board through an open international or national bidding process. Health Minister Dr. Kalumbi Shangula told the National Assembly the now infamous condom tender was submitted by the Health Ministry in August 2021. The bid of $650 million had 419 items, including gloves, condoms, operation material, and ICU items, among others. The Central Procurement Board cancelled the 2-year clinical supply tender sparked by public outcry. Following that, a new clinical supplies bid for 6 months, totaling $67.5 million, was issued in June, attracting 83 bidders. Earlier this month, the Procurement Board finalized its selection and is now busy with its considerations.
There is around 56 items not selected. If everything goes according to the plan, we might have a long-term contract only in January 2024. So I'm mentioning all these steps for you to appreciate the different stages and processes which are involved in the procurement.
Another 2-year supply tender for general pharmaceutical goods had also not been finalized due to a court process instituted by an aggrieved bidder. Dr. Shangula added that it is clear that no long-term supply tender will be finalized by the Central Procurement Board this year, and that interim supply measures will continue. The minister, however, says the procurement of medicine in Namibia has become a lengthy, cumbersome process. This has compelled the ministry to engage in highly costly procurement and buyouts for pharmaceuticals and clinical items. About 85% of Namibians depend on state-funded healthcare services provided at more than 1,500 health facilities spread across the country.